and I'm going to be taking care of you today. I brought a packet of information for you, but I don't want you to get overwhelmed. It may look like a lot, but we're going to break it all down for you. I know the doctor just came in and talked to you about what's going on, but I wanted to see how you're feeling and check and see if you have any questions. I imagine that was a lot to take in all at once.
Yes, I actually do have some questions. That was a lot to take in. I already know that I have high blood pressure, and I can't remember to take my medicine for the life of me for that. And I know a couple years ago they taught me how to manage my diabetes, but I still don't really understand what's going on. The doctor used a lot of big words. Can you help me out?
Yeah, so it sounds like that overwhelmed you, so let's try to break down each piece individually so it seems less overwhelming. I printed off some information for us to talk about, and you are going to take this information home with you in case you need it to refer back to later on. So the first thing I want to talk to you about is your high blood pressure, which are on these handouts right here. This handout explains some ways to limit the amount of salt in your diet, which is right over here, and it also gives you some helpful tips on how to read food labels. Both of these things can help in lowering your blood pressure, which will help your overall health. There's also a checklist over here on this side to help you remember to take your medications, and it includes things like setting alarms on your phone, using a pill box, and writing down on your calendar when you need to refill your prescriptions. So now let's talk about your liver. Your doctor probably used the word cirrhosis, and this just means that excessive scarring is present in your liver, like you can see in this picture right here. Lots of things can lead to cirrhosis of the liver, including hepatitis, excessive alcohol use, drug use, and issues like chronic hypertension and diabetes. Over time, your high blood pressure and type 2 diabetes have caused stress on your blood vessels and caused them to change their structure, which results in a buildup of plaque and scar tissue in your liver, which is why this looks so different from your normal liver right over here. When this happens, less blood and oxygen are able to get to important organs like your liver and prevents them from functioning properly. Diabetes and being overweight can also lead to more fat developing in your liver, which makes it more difficult for your liver to perform its usual functions. On top of this, even though you haven't had a drink in 2 years, your history of alcohol use likely caused some scar tissue and structural changes in your liver, leaving it more susceptible to the effects of your high blood pressure and diabetes. Your doctor also told you that your liver problems are being worsened by portal hypertension. So what this means is that due to all of the scarring in your liver, blood is unable to flow through it appropriately due to the resistance in your veins because of the structural changes due to your various disease processes in your history. So what happens then is that all of the blood backs up in the portal vein, which is right down here, which is the vein that leads into your liver and supplies your liver with blood. Does all of that make sense so far?
Yeah, it does. So basically you're telling me that my history of alcohol abuse, my high blood pressure, and my diabetes, and possibly my weight gain, all has to do with the buildup of the scar tissue and fat in my liver that is preventing it from functioning normally?
Yeah, that's right. So have you noticed any changes in your body or the way it's been functioning recently?
Actually, I have. I've had some unexplained weight loss. I'm super tired all the time. There's been yellowing in my skin. The whites of my eyes are yellow. And I just can't understand, I guess, what's going on with me.
Yeah, well, all of those things are related to the problems you're having with your liver. The one I want to address specifically is the yellowing of your eyes and your skin. That is directly due to damage in your liver and is a result of your liver being unable to get rid of a substance called bilirubin, which is responsible for breaking down. So it's building up in your body, and that is leading to the yellowing that you're seeing in your eyes and on your skin. I know this is all a lot to take in right now, but an important thing to know is that this liver damage is not reversible, and if we don't begin treating it soon, your liver is going to lose function entirely. So your doctor thinks the best thing for you right now is to have a liver transplant.
Okay. Well, it's a lot of information to take in. It's really overwhelming. I have a husband and 3 kids. What if I die during this transplant? What am I supposed to do? Like, it's just too much to take in.
I understand. I know this is overwhelming and sounds like a really scary process, but I do want to let you know the overall success rate for liver transplants is between 85 and 90%. And I want you to know that your healthcare team is going to do everything we can to make this transition as smooth for you as possible.
Well, thank you for all this information. I need to call my husband. I probably need a couple minutes to process everything.
Okay, take all the time you need, and I'll be back to check on you in a little while.
Hey, Miss Jones. nurse today, okay? Do you still have that packet from earlier?
Yes.
Okay, good. Do you have any questions so far?
No, I'm just gonna follow along.
Okay, well I'm going to tell you about the diagnostic tools and tests that we have to have before we put you on the list for the donor list, okay?
Okay.
So the first thing we're going to do is a blood test, and it determines the different problems that could happen, like with the transplant. For example, a lot of cirrhosis of the liver patients have a higher chance of getting liver cancer, and we want to make sure that you don't have any issues before we put you on the list. And then we're also going to do another type of blood testing where we look at your HLA typing, or human leukocyte antigen typing, and a cross-matching, which is to determine if your body's developed any antibodies to a foreign tissue. And basically it's just trying to see if your body's going to reject the new liver. So some other tests we're going to do is a chest x-ray, lung function test, blood oxygen test, electrocardiogram, echocardiogram, and stress echo, coronary angiograph, kidney function test, ultrasound scan, CT scan, MRI, liver biopsy, and endoscopy. And all of these are just to make sure that your heart and lungs are functioning correctly, and to make sure that you're going to be able to withstand the surgery, and that the survival rate's higher, and just make sure everything's going to be great. Let's see. So your packet explains these tests in more detail, so if you have any questions at all, please feel free to ask me.
Okay. I do have one question.
Okay.
Now, I understand I need all of these tests you just went over, but what good will they do if I can't afford a liver before someone else gets a liver before me? And I know, isn't that how they get onto the liver transplant list, is the people who have the most money at the top, and they get, they get the liver first before I do?
No,
How is that
it has
fair?
nothing to do with your money. It's
Okay.
all based on your test, and a lot of it has to do with your blood typing, body size, severity of the disorder, like the distance between the donor and the patient's waiting time, and whether the patient is available for the surgery.
So there's a lot of factors.
There's several factors. It has nothing to do with money at all. So
Okay.
it should not be an issue.
Thank you.
You're welcome. Hey, Ms. Jones.
Hi.
I see that you're back, and your surgery's in a week. Is
Yes.
that right? Okay. And you're getting a liver from a deceased donor. So the first thing we're going to do is do a final cross match the day of the surgery, and the results are going to determine if we're going to continue the surgery or not. So if your results are negative, then we'll continue with the surgery. But if your cross match comes back positive, then we're going to have to cancel your surgery. Okay.
Okay.
So first we're going to do a physical, and then you're going to meet with your medical team, which includes a surgeon, a nurse, anesthesiologist, and the transplant team. And then we're going to prep you for surgery, which would include an IV, and then we're going to give you some medicines to help you relax. And then the anesthesiologist will give you a general anesthesia to put you to sleep, and then you'll be taken to the operating room, okay? So once you're back there, the surgery's probably going to take about 6 to 12 hours, so keep that in mind. It's a pretty long surgery. Surgeons will remove the injured or diseased organ and replace it with a new organ. And then you'll receive several tubes that will be in your body, which include a breathing tube, an IV, which will provide fluids and medication during the surgery and afterwards, a catheter to drain urine from your bladder, and tubes in your abdomen that will drain fluid and blood. So then after surgery, you'll immediately go to the ICU for about 1 to 2 days, depending on how you tolerate the new organ. And then when you're in the ICU, the patient, you will be on a ventilator and fully conscious, until you're fully conscious and able to breathe on your own. And then we'll monitor your fluids and electrolytes, and we'll start you on your immunosuppressive agents. It'll help you not to reject your new organ. And then the dose will be adjusted based on your blood levels and liver function. And then we're going to look out for signs of infection, rejection, and bleeding. And that basically we're just going to look at your incision and pay attention to if there's any redness, and look at the drainage color, and if you have any severe pain, or if you have a fever. We're going to look at all that, make sure that everything's going to work out. And I think that's about it. Do you have any questions?
I don't.
Okay.
Hi, Ms. Jones. My name is Erica. I'm going to be your nurse that's following up with you after your liver transplant.
Okay.
I'm going to go over a couple of critical teaching points with you. First, I'm going to go over the medications that you're now on. First, we'll go over immunosuppressants. What these are is they're anti-rejection medications. These medications help prevent the body from attacking the new transplanted liver that you've gotten by suppressing your immune system. Now with this medication, you will have to be taking these for the rest of your life, and that's just in order to make sure that your body tries not to fight off the new transplant that you've gotten. Your doctor will look over the dose over time and may reduce it or increase it depending on how your body responds to your transplant. Now your doctor will also likely prescribe a combination of immunosuppressant drugs, which is viewed as the standard triple therapy. And what this includes is a calcineurin inhibitor, medications like cyclosporin or Prograf, a corticosteroid like prednisone, and a mycophenolate, Mofetil, or Cellcept.
Okay.
The next type of medication that you'll be taking are anti-infectives, and these medications are to help your body fight off any type of infection, which you're at higher risk for now because your immunosuppressants that reduces your immune system. Do you have any questions so far?
Not really. That was just a lot of information. So is there anyone I can call if I have questions about my medication?
Yes. What I will do is I'll go ahead and provide you a list of phone numbers. That'll include your doctor and your pharmacy, so you can follow up with them for any specifics.
Okay, great.
Okay. So I'll just go quickly over and summarize the teaching points pertaining to your medications. Make sure that when you take your medications that you avoid grapefruit juice. Grapefruit juice can interact with some of these transplant medications that you'll be taking. So we want to make sure that you just avoid it in general. We also want you to avoid drinking unpasteurized milk or any untreated water, as these can have infections, and because your immune system is low, we want you to try to avoid that so you don't get sick.
Okay.
We need you to notify us if you have any type of symptoms like a fever, a rash, or any GI symptoms. That could mean that there may be an interaction with your medication. Another critical point to make for you now that you have your liver transplant is that we want to make sure that you keep up to date with your your vaccinations. You and your family want you both to be up to date with that to avoid any type of infection.
Okay.
And then we also just want you to remind you good hand washing skills. Try not to be around a lot of sick people. We want you to drink enough liquids, eat healthy foods, get plenty of rest, keep active with liquids. You should drink a lot of water, but just avoid alcohol in general. As you remember, that goes through your liver, so we want to make sure we keep that as healthy as possible. And then in terms of your diet, we want to make sure that you eat plenty of fruits and vegetables, lean meats like chicken and fish, healthy grains and cereals, and then keep a low fat and low sodium diet. And then what I'll do is I'll also give you some information for your dietitian just in case you have specific questions.
Okay, and you mentioned that I need to stay active, so is it okay for me to still play football on the weekends?
Unfortunately, we're going to have you avoid any type of impact sports. We want to avoid any type of injury that may happen for where your surgery site is. So we recommend doing any kind of aerobic exercises, a little bit less aggressive, like running and swimming.
Okay.
All right, so a couple ethical issues with organ transplants. One of them is organ supply versus organ demand. This pretty much has to do with there being very long waiting times for people who are on the list for organ transplants. In fact, we found statistics that said every 10 minutes someone is added to the donor list, and over 7,000 people die while waiting for a transplant every year. So you can see that's really important to kind of address that. Another issue is traveling to other countries to receive transplants. People have not been able to get a transplant quickly here in the United States, so they travel to other countries, and that also creates problems like a risk for infection. And then illegally selling organs to the black market is another issue where it basically exploits the poor or needy people to do like having to go through the black market to buy organs. Another ethical issue has to do with deceased donors, and it kind of revolves around the idea of at what point is the person considered to be deceased. There are different views, like when they're unable to breathe on their own, when their heart stops, or when they're brain dead, so that's another issue in itself. Revolving Christian caring issues. As nurses, we have to remember that we have to be respectful of different religions and different cultures who may see organ transplants and giving organs to other people as an issue, so we have to be respectful of that. And then also another Christian caring issue has to deal with new medical technology, and we may have different perspectives and whether or not, what it says in the Bible according to the new medical technology. But overall, as Christian nurses, we should really look differently at the people that we take care of and treat them with compassion and patience and act in a way that Jesus would.